Hey doing everyone, welcome back. Well, as you know, I am in the United States of America, specifically the state of Iowa. And for those of you within this country, you probably are aware that in recent years there has been a call to implement Medicare for all. For those outside of our country who don't know what Medicare is, it is basically health coverage for our senior citizens after they retire. That's a simplified version of it. Because obviously they lose their private health insurance because they're no longer employed, and they still need coverage. It's something that benefits that they've paid into, and how is that different from Medicaid? Medicaid is typically, and not always, but it's typically for low-income individuals. Okay? So, for those outside the country, just the simplified version is Medicare is for the old and Medicaid is for the poor. Okay? That's the simplified version. It's not really that simple, but that's the best way to explain it without doing a complete video on it. And most of us, we know that, I have viewers in other English-speaking countries, predominantly Canada. Love you, Canada. You're still the largest. You've dropped below the almost 50%, but you're still in the high 40s. So I still love you, Canada. You are still my largest audience by far. But yeah, in addition to the United States, Canada, I've got a huge audience there. Well, huge for a tiny channel. Huge in terms of the percentage of my viewers. I also have my third largest viewership is the UK, according to my analytics. And I also have some viewers in Australia. I've seen you in the comments, Aussies. So to my Canadian, British, and Australian friends, right? I understand that you've got your national health coverage plans, right? The government takes care of that. And their Medicare for all that some people want to implement in this country would effectively be a version of your system. Obviously it's going to be different because every country is different in one way or another. So, like, I don't know, Canada, is your system exactly like the UK or Australia? I don't know. I know that you've got the same concept, though, where it's basic coverage. But I don't know enough about the national coverage, the universal coverage in each country. So, anyway, Medicare for All would be our version of your national coverage. So, where was I going with this? I didn't really get derailed. I just kind of got sidetracked in my head. Several months ago, I changed jobs. Now, health insurance is tied to your job in this country. Okay, I probably said that already, but in case I didn't, there you go. It's tied to your job. Now, when I changed jobs, I was enrolled in a new health plan with under a new insurance company. Now, according to this new insurance company, keep in mind, the only thing that changed is the insurance company, right? I have not changed locations, but my doctor is now out of network. Okay, well, I don't know exactly how that happens, but sure. So I can't go see the doctor that I've been seeing for several years. Which I have prescription medications. My doctor needs to prescribe those medications. Now, it's not like, my physical health. It's not like, I'm taking cholesterol medications or, it's not like, it's not for any physical ailment, my medications. I've been open about my mental health struggles. I'll probably open up more on that as this channel goes on. But that's what my prescriptions are for. And if I don't have those medications, it's not good. It is not good. Not only for me personally, but for those around me. It is not good. So, my prescriptions were low. I didn't realize that I didn't have refills left. So I called the pharmacy, to let them know that, hey, I'm due for a refill. They said, well, you don't have any refills. Okay. And I couldn't call my doctor to get the refills because I don't have that doctor anymore. Now, this has all worked itself out. I do have my medications. But I had, I take 2 prescriptions. Now, one of them, if I don't take it every day, it does have a physical effect. Okay? It does affect me physically if I don't get that every day. That, fortunately, is not the one that I desperately needed. The other one, however, I had one pill to last like 4 days. So it's like, I need to figure out just exactly, when to take this, or do I just not take it at all? Anyway, we've got it all straightened out. And, I remember, being told that, when during the Obama administration, now keep in mind, Obamacare, not a perfect plan by any means. Better than what we had previously. Oh, and by the way, for those of you who don't like Obamacare, but you like the Affordable Care Act, they're the same thing. They are the exact same thing. Yes, we actually do have people who don't realize that Obamacare is just the nickname for the Affordable Care Act because it was Obama's healthcare plan, right? It was his plan. The official name is the Affordable Care Act, but it originally came about as a derogatory name. Well, we don't like Obama, so we're going to call it Obamacare and whatever. But yet they like the Affordable Care Act. Anyway, I digress. That plan, not perfect. An improvement, but not perfect, and it does need to be fixed. And maybe we need to do this stuff incrementally. incrementally in this country. I mean, I know a lot of people, they don't like, we have a lot of people, particularly on the left, they don't want incremental anything. They want, hey, look, let's fix it all right now. And certain things, I agree with you on that. Certain things, hey, you know what? Let's take care of that right here, right now. Like the whole thing, yes, make a radical change right here, right now. Other things, not so much. Let's step back, take a look, make sure that that the change that you want is actually practical and going to work. Okay? I mean, do we need universal health care in this country? Yeah, I think we do. I think we do. I haven't always believed that, but yeah, we absolutely do need that. It can help situations like mine where I switched a job and my insurance company decided that I couldn't see the same doctor, so there was a lapse in my prescriptions. Okay, so it would help in a situation like that. It would also help in a case where, let's just say, maybe through no fault of your own, you lose your job. The company downsizes. Now you don't have your health insurance anymore, right? Or let's just say you decide you're going to take a risk and start up a business. You have health coverage. You can do that. You can do that. Yeah, and for those who like to say, well, that's just socialism and socialism sucks. Well, there are other socialist aspects of our government that you absolutely love. There are. We are a capitalist-socialist hybrid that, we do lean more heavily toward the capitalist side of things, but we do have socialist aspects of our government, and we have for a very long time. Longer than anyone watching this video, more than likely, has been alive. Longer than my mother's been alive, and she's in her 70s. So, do we need universal coverage? Yeah. Mine is a less extreme example. My example is not very extreme, but there are certain cases where people for whatever they can't work, or they want to start up a business but they can't do it, or maybe they work in a toxic environment where they have to get out now, but they have a hard time finding a job, or maybe through no fault of your own you lost your job and now you're struggling to find something. So, to my Canadian, British, and Australian friends, I think y'all might be onto something there. And not to mention all the other countries that also have universal coverage, but those are countries where I know for a fact I have an audience. So, anyway, yeah, we should absolutely do something about health coverage in this country, and make it easier for everybody. Think about it. I'll catch y'all next time.